In recent years, more and more people have discovered during routine health checkups that they have fatty liver disease, commonly known as fatty liver. Some individuals, not experiencing obvious discomfort, tend to ignore the condition. However, the abnormal buildup of fat in the liver can gradually worsen if left untreated, eventually progressing to severe issues like cirrhosis. Today, we will discuss in detail what fatty liver disease is, its main causes and risk factors, the early symptoms that may appear, how it is diagnosed through various tests, and the proactive steps to manage and treat the condition. What is fatty liver disease? Fatty liver disease refers to a pathological state characterized by the abnormal accumulation of fat within liver cells. This phenomenon is not an isolated disease but rather the result of multiple factors. Clinically, fat deposits in the liver can be detected using imaging techniques such as ultrasound, CT scans, or MRI. Fatty liver is typically classified into two types. One is simple steatosis without significant inflammation, and the other is steatohepatitis, which involves inflammation and even fibrosis, the latter potentially progressing to cirrhosis over time. It is important to note that most cases are nonalcoholic fatty liver disease, NAFLD, which is closely associated with dietary habits, lifestyle choices, insulin resistance, genetic factors, and metabolic syndrome. Causes and risk factors of fatty liver disease. The development of fatty liver is often the result of multiple factors acting together. Common risk factors include the following. 1. Obesity and overnutrition. Excess weight and obesity are the most common risk factors for fatty liver disease. Even among individuals with similar body mass indexes, some may accumulate fat predominantly in the visceral area. A rapid increase in body weight or waist circumference often leads directly to fat deposition in the liver. Example: David, 45, has a hectic work schedule and frequently eats out and indulges in binge eating. Several checkups revealed abnormal liver function tests and increased echogenicity on ultrasound. Further evaluations confirmed that he had fatty liver disease. By controlling his diet, reducing high-calorie food intake, and losing weight gradually, his liver function slowly returned to normal. 2. Age, gender, and lifestyle habits. As we age, our metabolic and self-repair capabilities decline, leading to a higher incidence of fatty liver disease. While males tend to have a higher prevalence in early and mid-adulthood, after age 50, changes in estrogen levels can make females increasingly susceptible. Additionally, a sedentary lifestyle, lack of exercise, and poor daily routines further increase the risk. Example: Linda, 62, after retirement, led a largely sedentary lifestyle, spending most of her time watching TV or using a computer and rarely exercising. A routine checkup revealed significant fat accumulation in her liver. Following recommendations from her family and doctor, she began taking daily walks and joining a community Tai Chi class, which gradually improved her lifestyle and liver condition. 3. Excessive intake of high sugar and high fat foods and beverages. Long-term consumption of high sugar and high fat foods or excessive sugary drinks can lead to insulin resistance, resulting in excess fat deposition in the liver. Although alcohol is a known risk factor for alcoholic fatty liver, even in non-drinkers, a diet rich in sugars and greasy foods can trigger non-alcoholic fatty liver disease. Example: Michael, 38, has always enjoyed drinking sodas and frequently eating fast food, never passing up fried foods at gatherings. During a routine checkup, his liver exhibited a bright liver appearance on ultrasound. After receiving expert advice, he quit sugary drinks completely and adjusted his diet, leading to a marked improvement in his liver indicators. 4. Other metabolic disorders. In addition to the factors mentioned above, conditions such as hyperuricemia, hypothyroidism, sleep disorders, and polycystic ovary syndrome can indirectly contribute to excessive fat accumulation in the liver. Some individuals with a family history of fatty liver disease may also be genetically predisposed to developing the condition. Symptoms of fatty liver disease. Fatty liver disease often develops silently. In its early stages, patients usually experience no discernible symptoms, and the condition is frequently discovered during routine health examinations by finding abnormal liver function or increased liver echogenicity. Some individuals might notice mild discomfort in the upper right abdomen, fatigue, or vague liver area pain, but these nonspecific symptoms are easily overlooked. However, as the disease advances to steatohepatitis or cirrhosis, more pronounced symptoms such as indigestion, jaundice, loss of appetite, nausea, and weight loss may develop. How to accurately detect fatty liver disease? Imaging examinations are currently the primary method for detecting and assessing fatty liver disease, with ultrasound being the first-line method due to its convenience, non-invasiveness, and safety. Ultrasound. This technique can directly display the enhanced echogenicity of the liver, helping to assess the degree of fat deposition. CT and MRI, when necessary. These imaging techniques can further determine fat distribution in the liver and help rule out other abnormalities such as cysts or early-stage liver cancer. It is important to note that while these imaging methods can detect fat deposits, they cannot completely differentiate between simple fatty liver and the more severe forms involving inflammation or fibrosis. Therefore, liver function tests and other laboratory examinations are often needed alongside imaging for a comprehensive diagnosis. Should fatty liver disease be actively treated? Regardless of the presence of obvious symptoms, fatty liver disease should never be ignored. If lifestyle changes are not made, the fat deposition can gradually lead to more severe liver damage, such as nonalcoholic steatohepatitis, and eventually cirrhosis. Treatment for fatty liver focuses on several key areas. Lifestyle improvement, change sedentary habits and increase daily physical activity. Dietary adjustments, control the intake of high-fat and high-sugar foods, and increase the proportion of vegetables, fruits, and whole grains, opting for low-calorie yet nutrient-rich foods. Weight management, through regular exercise and proper diet, gradually lose weight to lessen the liver's burden. Managing associated conditions, for patients with diabetes, hypertension, hyperuricemia, or other metabolic disorders, it is important to manage these conditions under medical supervision to reduce the risk of fatty liver development. Regular re-examinations, particularly for high-risk groups such as obese individuals and those with metabolic syndrome, it is recommended to have regular liver function tests and imaging studies to detect any changes early. Example: Emily, 55, who was overweight and had mild diabetes, was found to have significant fat accumulation in her liver during multiple checkups. With guidance from a nutritionist, she implemented a low-fat, low-sugar diet and began brisk walking daily. Over the course of 6 months, she successfully lost weight, and her blood sugar and liver function levels returned to near normal ranges. Which groups should be especially cautious? High-risk individuals for fatty liver disease primarily include people with obesity and/or metabolic syndrome. Excess body fat and insulin resistance are major contributors to fat accumulation in the liver. Individuals with diabetes or prediabetes. Abnormal blood sugar levels favor the deposition of fat in the liver. Those with a limited or unbalanced diet, regular consumption of high-calorie, high-fat foods can easily lead to fat buildup. Middle-aged and older adults, as metabolism slows with age, the liver bears a heavier burden. Individuals with a family history of fatty liver disease should also undergo regular examinations. For these groups, early screening and intervention are crucial to developing a personalized prevention and treatment plan that can prevent the condition from worsening. Although fatty liver disease often presents asymptomatically in its early stages, it poses a significant hidden health risk that should not be ignored. Through scientific dietary management, regular exercise, and routine health checkups, it is possible to reverse or improve the condition. Changing lifestyle habits, reducing the intake of high-fat and high-sugar foods, and promptly addressing other metabolic issues are key to preventing further liver damage. Early intervention, particularly in high-risk groups such as those with obesity, metabolic syndrome, or older adults, is vital to reducing the risk of progressing to cirrhosis. As the old adage goes, better safe than sorry. Everyone should pay close attention to their daily habits, undergo regular checkups, and seek prompt medical attention when necessary. Only by fundamentally improving our diet and lifestyle can we effectively protect our liver health and prevent further complications. Let's take proactive steps today to safeguard our health and that of our loved ones, ensuring a future full of vitality and hope.